talk about individuals, but I also want to talk about systems. So I want to talk about both. So I'm kind of doing what you want me to do, but not totally there. When we look at the science that we have around working with our youth who are at risk of or who are entering into the juvenile justice system, what we've learned from our science is that we need to be working across systems. We know that from the studies that have been done around risk and protective factors. We know that how those risk and protective factors are embedded in the ecological model around family, around school, around communities, and around peer groups, as well as the individual characteristics of the young people themselves. For many of the youth who we work with in the juvenile justice system, they come to us from other systems. They don't just show up one day in the juvenile justice system. We see them in our schools struggling, we see them in our behavioral health systems, and for many of them we see them in our child welfare system. So in my presentation today, I want to focus on this kind of cross-systems lens and what it takes to do this work well and what we need to understand about these youth in order to create systems that will respond better to them. If any of you have done practice in the juvenile justice arena at the local court level, and you had either currently electronic records or you historically had face cards, written hand records, you know that you can look at the face sheet on a juvenile offender and trace them back into their early childhood, if your systems actually documented that effectively. Most don't, but many do. You would have seen them show up early on as abused and neglected children often. You would see them migrate into status offending, where they would have been truant or ungovernable or runaway, and then often on into minor delinquent offending and then into more serious delinquent offending. We saw that. We knew that a lot of these kids started with abuse and neglect. I think Kathy Spatz-Widdom's early research that showed the higher probability that kids who are abused and neglected would end up in the juvenile justice system really grounded us in that notion. What we didn't know was, why did that happen? I think many of us assumed that it was directly related to the trauma that the young people experienced, but we really didn't have evidence around that. What we know now is what we saw in those face sheets, what Kathy documented in her research, is very real in communities all across the country. The prevalence of young people moving from abuse and neglect in their histories into delinquency range in various studies from 9 to 29%. So children known to the child welfare system moving into juvenile justice, the prevalence is between 9 and 29%. That's the current involvement leading to. If you do a retrospective look at who these young people are, you'll see that in a particular study out of New York, that youth released from their juvenile correctional facilities, 65% of the girls and 46% of the boys involved in the juvenile justice system previously received child protective, preventive, or foster care services. So when you look retrospectively, it of course would be a larger number in terms of those children. Intergenerationally, if we follow those kids into the next generation, those youth, tracking them to age 28, which New York recently in the past year did, you'll see that 42% of the girls were identified perpetrators of abuse and neglect of their children, the babies they had. So the intergenerational phenomena is also true. If you study the causes and correlates work that was done by Thornberry, Lober, and Huizinga, and I think confirmed through many other research projects, you see that perhaps the highest correlation in terms of risk factors for later moving into delinquency are two: abuse and neglect, and then gang activity. Those two alone are the highest correlations to moving into delinquency. So what is it besides the trauma? There's something's going on here that would lead so many kids to move from the abuse and neglect into delinquent behavior. This is what we're finding from our research that we are either conducting or that we are discovering and synthesizing at our center at Georgetown. The number one thing we need to do is be working across systems with our child welfare agencies, because the kids who cross over tend to experience more placements. So the number of placements is directly linked to how many of these kids will cross over into delinquency. And it isn't that you reach a threshold of 2 or 3 placements kind of gets you to a critical mass. Every movement increases the probability a young person will move into delinquent behavior. The type of placement. If in the foster care system we can work with our young people to keep them with families and stable placements, we have a much lower probability they will move into delinquency. But if we put them into group care or large congregate care, that placement is related to a higher movement into delinquent conduct, or at least the risk of being referred into the delinquency system. The age at the time of maltreatment. Persistent abuse has always been identified as a correlation. However, what we're also seeing is that adolescent abuse alone is related to this movement of young people from abuse and neglect status, a victim, into becoming a victimizer in the delinquency system. If you think about adolescent behavior, you think about brain development, you think about large placements with kids with high mental health needs and the contagion factor, this shouldn't surprise us as to why congregate placement of youth, adolescents who are being abused and neglected would lead to that outcome. The lack of social bonding opportunities that occur or don't occur in placement for kids in the child welfare system. What we're seeing in our research is that when children are placed, when we move them around a lot, we have them change schools, we don't allow them in their placements to connect to the pro-social activities that they are normally engaged in, lacrosse, soccer, clarinet, whatever it is that they do. When their placements don't allow them to continue with those activities, they suffer and they end up with higher levels of referral. Those are risk factors. There are two correlations, two covariates that we've identified that I think are cause for concern that I want to mention as well, that we could call risk factors, but I think they're perhaps more the traits of the young people that we need to pay attention to in terms of our case management. One is gender. Girls have a higher likelihood of crossing over from child welfare status into delinquency status. We see this sometimes in status offending as well. So what is the reason for that? Why are girls being referred for their misbehavior at higher rates than boys are being referred? And then race. Children of color who are in the foster care system are transferred over, are referred to delinquency systems at a higher rate than children not of color. So we know there's disproportionality issues in child welfare. We know there's disproportionality issues in juvenile justice. Systemically, something is happening between those two systems that is leading the young people of color who act out while in child welfare placement to more readily being referred into the delinquency system. For children who are in this crossover population, as they've been called, we see poor academic performance. Again, this should not surprise us. If they're moving around a lot, that lack of stability, they've been traumatized by their abuse, they're not being kept in the same school, we're going to see children who have poor attendance, who are truant, and who become behavioral problems. In a day where No Child Left Behind is telling us we need good AYPs, and we've got zero tolerance policies in our school for misbehavior, it's no wonder that a lot of these kids are being propelled out of school rather than be retained in school. And then we see a much higher level of mental health and substance abuse problems with this population. As much as we see high levels of need in the child welfare population, in the juvenile justice population, we see over 80% where we have an individual mental health or substance abuse need or a co-occurring disorder. So what are the system responses? You know, if we have this kind of phenomena that the kids are moving more quickly, more readily over into the delinquency system, what kind of response is the court giving to these kids? What kind of response is intake providing or the prosecutor's office providing? What we're seeing in particular in a study that was done by Halemba, Siegel, Lord, and Zawacki in 2004 out of Arizona and now has been replicated in some other jurisdictions is that these kids penetrate more deeply and more quickly. So for example, in the Arizona study, it was found that while crossover youth constituted only 1% of all dismissed or informal diversion cases, they represented 7% of probation supervision cases. They represented 42% of cases placed in either private group home or residential treatment facility. There's inconsistent identification of who they are, or even if they're in the child welfare system, often when they get arrested. They're more likely to be detained at the front door of the system. A study done out of New York by Conger and Ross in 2001 indicated that crossover youth were 10% more likely to be detained. So how do we respond to this kind of disparate treatment for these kids? What is the multi-systems response that is absolutely required to do this work well? At level one, it means that we have to, at the intake level, law enforcement, intake workers, district attorneys have to be looking at finding alternative ways of handling these cases. Positive identification of kids, either at a school referral, a street referral, or out of a placement, and then alternative case handling procedures being instituted. And half the sites we work with in our project at Georgetown, the prosecutor's office would not allow a young person to be diverted if they committed an offense while in foster care. The simplistic thinking being there was no parent who could sign to guarantee compliance with the conditions of diversion, let alone whether the conditions were relevant for that young person. What is the role of the lawyers? We have in the dependency system a dependency lawyer, a guardian ad litem. Is that lawyer staying involved with the young person as they move into the delinquency system? We found in the research that if the lawyer simply stays involved, communicates with the public defender, communicates with the prosecutor, provides the contextual information for who these young people are, we could reduce commitments into the juvenile system by 50%. By 50%, which is what they accomplished in Los Angeles when they instituted that kind of procedure. How do we create across systems multidisciplinary teams that can better assess the cases and determine the complicated needs of this particular population and then connect them to the services? In one study done around the use of MDTs, multidisciplinary teams, in California, it found that it increased the education information, the number of strengths, and the number of recommendations for case planning in the court reports. It reduced the number of youth becoming formal delinquency wards, instead keeping them connected to the social services system. And it reduced recidivism by about 20%, a 20% change between groups that were kept in the system with the use of an MDT as opposed to not experiencing MDT. So there are methodologies, there are techniques we're learning from the research that can be effective. And perhaps most importantly, we need to make sure that we view across systems our juvenile justice system, which too often can be punitive and more accountability based, that we're looking towards the factors we look to in child welfare: permanency, safety, and well-being. And how do we cross-train between our staff in juvenile justice and child welfare to get to that permanency? The notions of connected by 25, permanency packs leading to transitional living as kids age out of the system in juvenile justice and move into the community on their own. This relates directly to the legislation we're talking about today. If we even look at just the Juvenile Justice and Delinquency Prevention Act and what it requires and really insists in many ways that OJJDP and the Children's Bureau do about helping jurisdictions to collect data around these kids and develop comprehensive responses to their needs, we would make great progress in seeing the systems change that's needed between the federal agencies and then how they support state and local policy. If we look at Capta, which also has provisions around this kind of cross-systems approach, we would see the need and actually the requirement in one of the provisions in that act to support and enhance interagency collaboration between the child protection system and the juvenile justice system. And then if we move forward and think about what can happen with the Second Chance Act, it has now been implemented and can provide the kind of holistic supports as kids re-enter systems. We think about some of the research we found in our center where kids who are leaving juvenile justice placement are at high levels returning to child welfare placement upon their return home. So that cycle continues. The Second Chance Act gives us an opportunity to make a difference in a different way for those kids, do more joint home studies, and plan for their permanency in a different way. And then if we really bring to life the Youth Promise Act structure and content, we really empower local communities to bring themselves together, study these populations, and provide the appropriate responses. Thank you very much.